the number one reason for physicians leaving the practice cited was pajama time, the associated time with doing EHR encoding at the end of their working day. Ambient listeners are changing that story. And so now some of those barriers to the joy of medicine are falling down, although, there's a lot of, frankly, challenges within some of the automated encoding. There's both an access, so not every physician has access to it, but then equally there's still the review process and the level of specificity that may be required. And I know we've spoken to some users who love it, what's going on, others who are still struggling with the output. But as we think about physician productivity, this does not just look like, in fact, I would say that I'm less interested in just a pure financial coding, e.g. an RCM platform. I'd be more interested in some of the other 25% of healthcare costs that are associated with administrative burden within the practice of medicine. And so, we can break that down, what that looks like. Chronic disease, look, whether you're a woman, a male, you've got obesity, you've got diabetes, there are so many big problems within healthcare, and too many patients are falling through the cracks. And so our hope is that we're finding partners and startups that are trying to decompose some of these challenges, right? And they look longitudinal in nature. We need partners who are willing to part with data. One of the amazing things that we've now seen systems doing is, Mayo, Cleveland Clinic, UPMC, through their Ahavi program, have actually released de-identified data. And so for certain access, they may take an equity position, or there may be a cost associated with it, but they're making it possible for startups to advance their own stories in a more meaningful way.